if you look at the overall evidence together, I do think that there is accumulating evidence demonstrating that lowering plaque in Alzheimer's disease is a good thing. So I think successful amyloid plaque lowering has never been attributed with cognitive worsening, but it always was attributed to cognitive improvement or improvement, less decline. What we as well have seen that it is highly dependent on the amount of exposure. I think that, for instance, was nicely demonstrated with Aducanumab. So we know that the more consistent, the longer individuals are treated, the more these effects can be seen. In Donanemab, for instance, it was very nicely demonstrated that you have to be early on in the disease spectrum. So they, for instance, looked into these tau PET measures where they demonstrate that those individuals that have a tau PET signal, but are early on with the tau PET signal, so have a lower tau PET signal, that those are the ones that seemingly seem to benefit the most from this therapy. So I think taking these two things together, that you have to target the right patient population, and you have to get a consistent and good exposure with your drug, monoclonal antibodies, or in our situation, the polyclonal immune response we want to work with the vaccine, then I think this is a very valid approach, and I'm quite confident that we will be able to demonstrate benefit for patients with this treatment. Now, the $100 million question is, will that be the only treatment? And I do believe that in the long run, we will need to have combination therapies, because obviously we are targeting A-beta here. We are fully aware that tau is relevant. You may have seen that we parallel at this conference, for instance, demonstrate an alpha-synuclein PET tracer. So we know alpha-synuclein plays a major role in that. There's neuroinflammation. So I think, yes, it's a very valid approach, but I don't think it will be the final answer to the disease. There will have to be more therapeutic development.